Welcome back to the Pelvic Health Summit. I'm sitting here with Dr. Tayyaba Ahmed, who is a osteopathic medicine doctor and a fellow at the Academy of Physical Medicine and Rehabilitation, and who treats patients at pelvic rehabilitation medicine in New York and New Jersey. Welcome.
Thank you. Thanks so much.
So I know that you treat a wide variety of pelvic health and pain conditions in your practice, but today I would love to focus on sexual health and sexual dysfunction related to pelvic pain conditions. So
Awesome.
Let's just hop in. Would you mind telling us a little bit about some of the common things that you're seeing in your practice?
Sure. The first symptom that people usually talk about is pain with sex. Sex is super important. It's important for your relationships. It's a way to let out some stress. So if people aren't able to have pain-free sex, they are very upset. Most of my male patients, usually when they get to the door, it's because they're having pain with sex or ejaculation, post-ejaculation pain, soreness in the perineum. Sometimes they have pain running to the tip of their penis during intercourse. Sometimes they have pain in their testicles. So it's usually one or the other. They usually don't present with pain in their testicles or pain in their penis, but they usually all have some sort of pain after ejaculation and soreness. They can also present with a combination of rectal pain, rectal burning, rectal itching. But this doesn't mean it's for everyone. Sometimes patients present with it just with intercourse, and sometimes they present with it all day long. And that's kind of when it gets a little bit more tricky and hard to treat. Oftentimes these patients are having the pain related to a hypertonic pelvic floor. So our goal is to start getting the blood flowing in the genitals and get the pelvic floor to be nice and relaxed, and then the goal is eventually the nerves will start conducting properly, blood will start flowing, and they'll start having pain-free intercourse. This isn't like a 1, 2, 3 thing. It happens over a period of time. I always tell my patients, when you water a plant, you don't get a flower the next day, you get it weeks later. And that's very similar to the stuff that we do at pelvic rehab.
Awesome. So can you tell us a little bit more about that watering process? What is the treatment plan and some therapies that you bring on to help with that process?
Sure. Usually when a patient comes in, we do a full hour discussion. We're trying to figure out what exactly is causing the problem. Sometimes if we don't treat the actual cause and they continue to do whatever thing that may be the causative factor, then things don't get better. So the important thing is to really delve into their history and find out what it is. I feel like I may have like a target on my face because I feel like a lot of people like to tell me things, and I don't know if it's because I ask a lot of questions, but I really want to know all the intimate details to why they're having these symptoms. This might be the time to say that usually it's related to some sort of intercourse incident where either there's rough sex, there could be a lot of masturbation going on. I've heard, I had one patient tell me that he did a lot of sexting with his girlfriend while his partner was away, and so the repetitive motion, it affected the muscles, and it really fatigued the muscles of the genitals. It also can be related to trauma. I had an older patient whose spouse had passed away years before, and she hadn't had intercourse for many years. And then when she went to reintroduce it into her new relationship, she was unable to have pain-free intercourse because of the trauma that was associated. So we kind of have to delve into what the cause is, figure it out, and then work on it, and then treat the pelvic floor. Treatment usually includes a combination of oral medication, possibly, vaginal or rectal suppositories if necessary, as well as injections to the pelvic floor, trigger point injections, and that's how we water. We literally put in, a liquid in a syringe, which can be steroid or Trameal mixed with lidocaine, into the pelvic floor, and over time that creates that space so that the nerves can now breathe and have more free-flowing movement. Did I say that right?
Yes, free-flowing movement.
Yeah.
That's a tongue twister. I'm glad I don't have to say it again. So, for those listening at home who might be experiencing painful sex, both men and women, what would you tell them their first step can be to seeking treatment, or what questions should they be asking themselves and their practitioners?
Unfortunately, a lot of people think it's normal to have pain with sex, so they never go to a doctor to tell them that, hey, I'm having pain with sex. And sometimes, I saw a patient the other day, and she was like, oh, I just assumed it was because my partner was big, and that's great, but that's not usually an acceptable cause. I try to explain to patients, it's not just entrance. Sometimes it can be pain on superficial insertion or deep thrusting, but it's never normal to have pain with sex, whether it's superficially or deep. If you are trying to figure out if it's normal, well, I'll tell you right now, it's not.
Okay.
So if you can't find a provider who doesn't believe that it's not normal, just keep going until you find one, so that this is not something you have to live with. There are many different tools you can use. I would say start with the pelvic PT. They are very well versed in different tools, dilators, lubricants that are better than the stuff you find at CVS or Duane Reade. There's also the suppositories. I have many pelvic PTs who request that I order lidocaine gel prior to physical therapy starting, so that they can use the lidocaine gel with the dilators. There's different wands you can get, but all of this stuff is relatively available on the internet. You can read on recommended sites, as well as on our website.
Do you have some more specific websites that our viewers can look up and use as resources?
Yes, on International Pelvic Pain Society, you can research you can put in your zip code and find out exactly where there's a pelvic PT near you. There's a website that you can find all the pelvic physical therapists who have trained with Herman and Wallace. And then depending on what other conditions could be causing your sexual side effects, if it's something like endometriosis, there's tons of resources on different Facebook groups, like there's the pelvic floor dysfunction group, there is a Nancy's Nook for endometriosis education for women who have endometriosis, and their pelvic and sexual dysfunctions are a little bit harder to treat because they require having an excision surgery prior, but that doesn't mean that it's not unheard of, and they can eventually have pain-free intercourse.
Let's talk about some myths. So one myth is that if you have painful sex, you won't have an orgasm.
If you have painful sex, you won't have an orgasm?
So if you have an orgasm, you assume that your sex can't be painful because you had completion.
No. Yeah, no, I mean, you can definitely, a lot of women have orgasms, but they have to grit and bear their teeth while they're having intercourse. It's not, even the men, like I've had male patients who just try to complete just to, make their partner happy, but they're having a lot of pain during it. So yeah, that doesn't necessarily mean that it's pain-free. Interestingly enough, when I tell family or friends that I'm a pelvic pain doctor, I've had one friend say, oh, so you only treat like homosexual men? And I was like, no, that's not what we do here. We treat all men. I guess that's a myth that only homosexual males have pain with intercourse, pelvic pain. And then also another myth is that only women who are postpartum have pain with sex. And that's totally not true either, because plenty of women postpartum have pain-free intercourse. But because of the tears and repairing of tears, they may have increased risk of having pain with superficial insertion.
I want to talk about Kegels.
Okay.
Kegels for women, Kegels for men? What are they good for? What are they not good for?
Yeah.
Is there any circumstance where you shouldn't do them? How
Yeah.
often should we? The second I hear the word Kegel, I just have to do one.
Well, that's great. Kegels are awesome if you have a hypotonic pelvic floor. If you have a hypertonic pelvic floor, doing Kegels is not good for you. It will actually make a tight muscle tighter. So definitely don't do Kegels. It's funny because I think a misconception, a lot of young guys hear, or they read in men's health magazines, because patients have told me this, that doing Kegels will make the penis longer or make them better, quote, better at sex. And that's not true, especially if you are making a tight muscle tighter. So definitely don't do Kegels unless you know you have a weak pelvic floor. And that's hard to say because unless someone examines you, you won't be able to tell. But what I would say is if you're not in pain, or if you're in pain, avoid them. If you're not in pain, you can probably do Kegels. But definitely, if you're a woman who's concerned with getting stress incontinence, or don't want to pee while you're doing jumping jacks or sneeze, you can probably just go to a pelvic PT, be examined, and then you can start your Kegels.
Okay, great. Thank you so much. So is there anything else you would like to share with us and let us know where we can reach you before we wrap up?
Sure. I'm at 41st and Madison and Hoboken all the time.
And how about online?
Online, I have my own Instagram at Dr. Tayyaba Ahmed, Tayyahmed, and I'm on Facebook.
Can you tell us something that most people don't know about sexual health and sexual dysfunction related to pelvic pain?
I guess most people, unless you're in New York and LA, you may not have ever heard of the O shot or the G shot. Those are two different shots that are used to enhance or give you an orgasm. Essentially, the difference between the two are one is putting collagen into the clitoris, and then the other is putting PRP, which is platelet-rich plasma, into the clitoris. This is something that we are thinking to implement into our practice, as what we noticed over the last year, a lot of our patients were having pain with intercourse and successfully are now having intercourse. However, they're continuing to not be able to orgasm. So we want to be able to provide that service for our patients, especially now that they're able to, have full penetration without pain. This doesn't mean that they're not orgasming externally and outside of intercourse, but they are just not able to while they're inside, and that may be changed once they get these shots.
Wow. We'll definitely link some information about this below. So can you tell us a little bit more before we wrap up about how patients can help prevent these sexual health dysfunctions, and also I know that some of these subjects can be taboo, how they can reach out and connect with you?
It's hard to say how to prevent, because oftentimes a lot of these cases come in, unless a lot of it's, could be related to a sports hernia, and which causes pelvic floor dysfunction. And so obviously you can't really avoid sports if you're really an athlete. Labral tears, same thing. For males especially, and females, the pelvis is all linked. So it's hard it's hard to say, okay, well, no biking, no spinning, no contact sports, when those are things people enjoy. But if you find that you're, feeling like you have some rectal numbness and you're like, that's, it's been going on for like a couple of weeks now, kind of think about what you're doing. Sometimes I'll talk to a patient and I'll find out we'll be talking, and then I'll get an email a couple of days later. I think I've been doing this like squatting thing, and I've been like passing gas, and that tick may have been what's causing my rectum to now feel that numbness. And then when the patient stopped doing it, like took a couple of weeks, months, and then now the symptoms have significantly reduced. So think into what is causing it. Oftentimes I'll hear young males in their 20s and they'll recall an incident when they had intercourse that may have been rougher than usual, and right after that the pain started. So we can't say, don't have rough sex, but be cognizant of it if you are a pelvic pain patient. I tell some of the male patients while they come in for treatment, try to be abstinent for a couple of weeks just to allow the muscles to have some time to repair and heal. There's a few Facebook groups that are really helpful. There is a group called Hurt Sex. It's like Hurt So Bad, like a group about pain, women and men who have pain with sex. On that group, they've asked me to be in the group, which I thought was super sweet, because someone on my Instagram saw me and said, could you please answer questions every now and then? Totally fine. And they post a lot of articles. One of the articles was ways to talk to your spouse or partner about pain with sex. You don't want to not tell your spouse. A lot of my patients who come into our office tell me that their relationships after they can now have pain-free intercourse is way better than it was before. They grow together, they learn how to communicate better. A lot of times they go to sex therapists together, cognitive behavioral therapists as well, and I'm sure in every town there has to be at least someone that you can talk to with your spouse regarding and communicate your needs. I recently did a talk for She Knows Media, and a woman in the audience raised her hand and said, oh, can you tell my husband, who's right here, that I have pain with sex and I don't want to do it all the time? And he was like, I don't understand, we have 5 kids. And she's like, well, having kids is not the only, it doesn't mean sex is not painful. We have to have kids, we got the kids, but you should understand if your spouse is in pain during it, it's not going to be pleasurable for either person. You don't want to see your spouse cringing when you're having intercourse. So there's different tools, and we talk to them a lot. Sometimes people use the lidocaine gels. There's different type of lubricants. There's dilators. An interesting thing that a patient told me was something called Clone-A-Willy, and she found it on Amazon. I don't know how it went for her, but you can actually clone your husband's penis, so you can use it as a dilator. Instead of using a dilator, use that. Because then you know what size you're aiming to achieve versus a dilator is just kind of a generic size. But yeah, I mean, there's definitely a lot of resources and different, things you can talk to. You can have your spouse come in with you for your PT sessions. They can learn how to stretch, do some perineal massage. They can help you with all your exercises. Why not just have some fun with it?
Awesome, thank you. And you also mentioned a few other practitioners that you work with, PT, sex therapists. Can you kind of share with us a little bit more about other practitioners that you collaborate with when treating these pelvic pain dysfunctions? So
usually, every time a patient comes in and they come in, we want to make sure that they've been cleared by their urologist, their GYN if they have one, a GI doctor, just because we want to make sure we're not missing anything bigger. And then if they've been cleared, we kind of treat them and we try to figure out if it's more psychological, if there is, a lot of young girls who start having, they're 16, 17, they start using tampons, they're starting, to explore having intercourse, they have a lot of pain, and then they think that's normal because they're not telling their parents. So sometimes there's a lot of, PTSD associated to having to put a tampon in that hurts, and intercourse, their first experience being painful, then they're like, I don't know if I want to have sex anymore. And so there is a lot of anxiety that's provoked from this. So speaking with a cognitive behavioral therapist, also a somatic therapist kind of works on the mind and the body and kind of tries to separate the two, because sometimes the mind and body is super connected, as we know. And they kind of makes it a little bit harder to treat if everything's kind of overwhelmed.
Well, thank you so much for being here, and thank you for telling us where we can find you. We'll link all of Dr. Tayyaba Ahmed's information in the description.
Thank you so much for joining us. Now I'd like to hear from you.
Please share with us one takeaway from the interview in the comments below. Give us a like and share this group with someone who you think will benefit. Thank you.